Hello, I am Dr. Pralhad Prabhudesai. I am consultant chest physician practicing at Lilavati Hospital, Mumbai. Today is the World COPD Day and our theme is Your Lungs for Life. Lungs are very important organs of the body where it generates oxygen from environment and provides oxygen through all over the body, which is the important mechanism of building up energy at cellular level. In chronic obstructive pulmonary disease, there is an obstruction to the windpipe, and this obstruction is progressive. It also may be associated with alveolar wall. There is a gas exchange unit destruction, leads to emphysema. Symptoms of this disease is chronic cough with sputum, breathlessness, initially on exertion, then at rest. This disease is progressive, which is gradual. But good thing is that there are new medicines are coming, new mechanisms are coming to improving decreasing the progress of the disease. This is very welcome. Disease is diagnosed by doing a spirometry test where there is an obstruction which can grade the obstruction. In some patients, when there are symptoms and we suspect COPD, we have other tests to diagnose like diffusion studies, sometimes HRCT chest, that is the CT scan of the lung, but they are not routinely required. Very important to know that in COPD, there are many comorbidities which decides the outcome of the disease, and every patient who is diagnosed to have COPD, we also look at the comorbidities which is associated. They are obesity, sleep apnea, ischemic heart disease, sometimes asthma associated with COPD, etc. And obviously in an advanced disease, there is an osteoporosis, etc. This understanding comorbidities in COPD is extremely important for a better outcome. Now, when we think about treatment, we have already discussed the causes of it. One of the important causes is smoking, but there are non-smoking causes like pollution and the environmental and occupational irritants which are there, the biogas, etc., which is responsible. The treatment is concerned. The main standard treatment is bronchodilators, which are antimuscarinic or long-acting beta-2 agonists. And now all these bronchodilators along with inhaled steroids has found to get a decreased exacerbations of COPD, that is worsening of COPD. The disease progresses, decreases, lung functions improves, quality life improves. Now, as well as the treatment is concerned, generally, we see how much patient is symptomatic. He gets exacerbations and require hospitalization or change in the medicines. And on that, we divide the patient into ABCD group, which is the new gold guidelines of treatment, and which has to be followed by every person. The next important treatment is smoking cessation. That's very important. In fact, that should be the first line of therapy, and improving the air around us at home, outside the home, and at the occupational site. Then vaccination, flu vaccination is very important. Even a pneumococcal vaccination is also important. The next important is pulmonary rehabilitation, that is exercises, which is equally important, like we treat the patient with bronchodilators. And with all these things, the quality of life of the COPD patient is better, the hospitalization they require least, and their symptoms are also decreased and they are well controlled. So with this, I would like to end with one important message, that keep our environment clean, promote non-smoking everywhere, and we should not only stop smoke ourselves, or we should not smoke, but we should not allow other person to smoke. Thank you.